Welcome to DermWire News, powered by DermWire.com. DermWire News for Smart Speaker is made possible with advertising support from Ortho Dermatologics. I'm Stephanie Talea, Senior Managing Editor with Practical Dermatology magazine. Bristol-Myers Squibb Company will acquire Celgene Corporation in a cash and stock transaction with an equity value of approximately $74 billion. The combined company, with complementary areas of focus, will operate with global reach and scale, maintaining the speed and agility that is core to each company's strategic approach, the parties say. The transaction will create a leading focused specialty biopharma company to address treatment needs in cancer, inflammatory and immunological disease, and cardiovascular disease. Under the terms of the agreement, Celgene shareholders will receive one Bristol-Myers Squibb share and $50 in cash for each share of Celgene. Celgene shareholders will also receive one tradable contingent value right for each share of Celgene, which will entitle the holder to receive a payment for the achievement of future regulatory milestones. The boards of directors of both companies have approved the combination. Based on the closing price of Bristol-Myers Squibb stock of $52.43 on January 2nd, the cash and stock consideration to be received by Celgene's shareholders at closing is valued at $102.43 per Celgene share and one CVR. When completed, Bristol-Myers Squibb shareholders are expected to own approximately 69% of the company, and Celgene shareholders are expected to own approximately 31%. New research suggests selective oral JAK kinase inhibitors may play a role in treating moderate to severe alopecia areata, or AA. The findings were presented at the Inflammatory Skin Disease Summit in Vienna, Austria. In this Phase 2A study, 142 adult patients with AA affecting more than 50% of their scalp were randomized 1:1:1 to receive PF 06651,600, a JAK3 inhibitor, 200 milligrams once daily for 4 weeks, followed by 50 milligrams once daily for 20 weeks, or PF 0670841, a JAK1 TYK2 inhibitor, 60 milligrams once daily for 4 weeks, followed by 30 milligrams once daily for 20 weeks, or placebo. The 24-week treatment with either the PF 06651,600 or PF 0670841 was efficacious and well tolerated in patients with moderate to severe AA, the study showed. Both JAK inhibitors demonstrated efficacy in achieving primary endpoint, severity of alopecia tool or SALT score from baseline, and secondary endpoints, SALT 30, 50, and 75. For all efficacy outcomes, PF 0670841 achieved numerically greater effect than PF 06651,600 at week 24. At week 24, both JAK inhibitors differentiated in percent change in SALT score from baseline and had acceptable safety profiles. The clinical effect of both JAK inhibitors in AA is also supported by the normalization of keratin expression within affected tissues, as clinical improvement was associated with significant increases in several hair keratin-associated genes that were downregulated in baseline pre-treatment lesions. Increases in hair keratins were already evident by week 12, with further increases at week 24, according to the researchers. Suniva Medical is partnering with Helion Medical and PureGraft to add 2 new products to their aesthetics portfolio. Helion Medical of Newbury Park, California, has signed a partnership with Suniva Medical for certain markets on their proprietary PRP technology, featuring a high platelet capture design and a long-term exclusive relationship on Helion's next-generation technologies, arriving to the aesthetics market mid-2019. Suniva Medical has a distribution partnership with Bimini Technologies for certain markets on their proprietary PureGraft fat grafting system for use within the regenerative skin and body care industry, and an exclusive relationship on their next-generation technology scheduled to launch in early to mid-year 2019. PureGraft LLC is a wholly owned subsidiary of Bimini Technologies. Their portfolio also includes Kerastem LLC and Aristem LLC. The combination of our world-class commercial organization and these unique and innovative aesthetic products strategically positions us for long-term growth as a leader in the regenerative aesthetic market, says Preston Rahm, CEO of Suniva Medical, in a news release. These new products will add significant breadth to Suniva's product portfolio. The new products join Belafil, Suniva's flagship regenerative biostimulatory product. Thank you for listening to DermWire News, powered by DermWire.com. This editorially independent program is supported with advertising from Ortho Dermatologics.